All right. Perfect. And let me just start by welcoming everyone. Thank you so much for being here tonight. I am extremely honored and excited to introduce the amazing Dr. Jill Carnahan. Now, I've had the pleasure of seeing Dr. Jill speak live at several events on behalf of Vibrant, and I want to personally thank you, Dr. Jill, for your vulnerability and your genuine inspiration that you offer, but not only for providers, but for everyday people like myself that deal with similar issues that you've overcome. If I'm being honest, I cannot help but tear up every time I hear your story. It is so powerful. So for those that may not know, Dr. Jill is a breast cancer and Crohn's disease survivor, and she is a huge advocate for functional medicine. Now, as a big part of your work, Dr. Jill, it's centered around toxicity, right? And how we can do our best to minimize our toxic burden in our everyday lives. So who better to present on our latest and exciting new lab test released by Vibrant Wellness, the PFAS test, than the expert herself. So I'm just going to hand it over to you. I don't know, I think I'm breaking up a little bit, but I'm going to hand it over to you, Dr. Jill. Take it away, and thank you again for being here.
You got it. Thank you, Jennifer, and good evening, everybody. I'm so excited to be here with you, and I am actually really excited about this topic. When I talked to Vibrant about presenting, I literally can't wait to tell you this information, and I'll share in just a moment some of the reasons why. So today we're going to talk about the brand new test, obviously with Vibrant, with PFAS, and the different types and why these matter to your patient's toxic load. But I'm going to start with just why it matters to me personally here in the state of Colorado. So interestingly, this article I wrote in 2011, I just wrote that date at the bottom because back a decade ago, I was starting to think about, okay, our environment, toxic load, obviously my history of breast cancer 20 years ago, because I remember after my breast cancer diagnosis in 2001, I was 25 years old. And I remember thinking about a year in, after I got through chemo and got through all the treatment and the surgeries, it's like, okay, why did this happen to me at 25? And one of the biggest things that I realized, which is why I'm so passionate about environmental toxic load and testing toxic chemicals and everything we'll talk about tonight, is because I realized that part of the reason why I got cancer at 25 years old was due to my toxic exposure and the combination of that and my poor detox genetics. So I realized that the toxic load, the exposures we get every day, the chemicals we come in contact with is a huge part. I think it's the elephant in the room with chronic illness. So back again, about a decade ago, I started writing. And interestingly, in the 5 pervasive chemicals, one of them at the very top was this PFOs. And back then I barely knew what this was. I thought, okay, Teflon and Gore-Tex, right? The brand names that we know on clothing and in pots and pans. That was all I knew about it. I didn't really realize how pervasive of an issue it was. But again, back a decade ago, I started writing and thinking about this topic. But again, it was very peripheral to me. I didn't think it was so pervasive or such a big deal. And you can see these are the 5 things I talked about a decade ago that were persistent and might be hidden in our homes, like BPA, PFOs of different types, which we'll talk about, phthalates, formaldehyde, and brominated like flame retardants. So, but then this came to my desktop July of this year. So July 29th, 2022, I saw the article in the Denver Post that there's no safe level and that almost all of my state's drinking water was contaminated with PFAS. And I started to take another look at this and say, oh my goodness, what is going on? Well, first of all, the EPA took the accepted safe limit, which we really don't know what's safe in many of these chemicals, and dropped it, which is appropriate because it protects us. What I learned in my history of breast cancer and diving into this was so often in the US, sadly, the EPA is now protecting us for things like atrazine that are still used all over the US, and they are banned in the European Union and other countries because they're so toxic and they're so carcinogenic. I think this is going to be another issue with this PFAS. And the biggest thing about this, if there's one takeaway in this presentation, number 1, we haven't been able to test. Number 2, we don't know the safe level. And number 3, these are called forever chemicals. And what that means is the scientists cannot even calculate the half-life of these things. Like it's way beyond decades and years and maybe 50, 100 or more. They cannot even calculate it. So what that means, and I'll tell you why in a few minutes, the compounds are incredibly persistent. They're hard to break down. And so as we're polluting our water supply, there is no easy way to get rid of these. They persist in the environment. And that's why this article started me thinking in July of this year. And then I wrote the next article. Well, first of all, you can actually look on the Colorado Public Health site and see how these chemicals enter the drinking water. And they have a map, and I'll show you later, a map that you can look in anywhere in the US. This is my state of Colorado, and this is the combination of PFAO, PFOS, and Gen X, which are the top three of the PFAs that we see in the environment. And you can see these dots, every one of these dots, each one represents a different type of PFAs. Our contaminated water supply. I mean, you can't even see through Denver in the middle there. And where I live, just north of Denver, kind of where you see Longmont. I live near Louisville and Boulder. There's just loads and loads of this in our water supply. So this is why I'm so passionate about it, because I realized, and of course, here we are in Colorado, we have lots of wildfires where they're using flame retardants, which are a known source of this. And we're like the Gore-Tex, ski kind of the people who do the outdoor activities, the hiking, biking, skiing, mountain climbing, and we all wear Gore-Tex, or we used to, right? So these are very relative to where I live, and that's why I got excited. So then I wrote another article. These are common sources: water-resistant clothing, paint, cosmetics, photography. And some of the things you might not think about are when you get that takeout food container, it has that like anti-grease coating, or if you're using any of those old pans, the non-stick pans, those are real common sources. Even your new carpet that is stain resistant, and all the new furniture that's flame retardant, stain resistant, or new carpets or things, those are commonly PFAs that are in your furniture, in your carpet, on your pans, and in the clothing that we wear. So this is the article I just wrote just a couple months ago after I saw that article in the Denver Post, because I thought, oh my gosh, we are swimming in this. It's in our water. We have to really be protected. And it's a forever chemical, which means the decisions we make environmentally now are going to affect our children and grandchildren and many, many generations. So that's why I got excited. And that's why when Vibrant said, hey, we're doing a test on this, would you, share? I'm like, yes, 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 because I've been pretty passionate about from my own state perspective. So what are they? We're going to go through today all of these different things. What are they? Routes of exposure, benefits of testing, which up until now we haven't had easily available, the list of the analytes, the methodology the lab uses, how to collect the specimen, all the basics here, and even pricing. And there's a special offer today that I've already ordered for 2 patients that I'm going to share with you at the end of the slide presentation. So as you can see, these go in raincoats and microwave popcorn bags. Who knew? So that's a reason to get your own, air popper or microwave, or not microwave popper, and stop using those microwave popcorn bags. Most fast food, most takeout foods is going to have coating on the materials that are carrying the food. And then flame retardant foams, which again, we had massive wildfires last year. My whole community of Superior and Louisville lost like 1,000 homes and businesses. And so it's very relevant, because as they spray the flame retardants here, when there's wildfires, we get exposure to these as well. So that's, I think, a big reason why it's so contaminated in the water supply. So what are these? Perfluoroalkyl substances are a group of over 4,000. They're fluorinated carbons. And this is why they're so problematic, because number one, they're incredibly strong bonds. So those carbon and fluorine bonds are so strong that they're hard to break down. And that's why they are considered forever chemicals and persistent in our environment. And like I said, when I read scientists can't even figure out the half-life, that stuff's pretty scary. And again, if our water is already contaminated, we need to start really thinking about this. They've been used in manufacturing processes. Basically, they're water repellent and they're grease repellent, which is why they're used in the nonstick cookware and the raincoats. And again, all the stuff that we wear skiing and outdoor, any sort of water repellent gear is usually made with PFAs. So they're common in our environment. Our sources. So where are we getting this? And up until now, I haven't been testing patients because we haven't had a test, but I'm suspecting that we'll see a lot of our patients have levels in their body. So contaminated food and drinking water are the main sources. And as I showed you, there are so many of our water sources in Colorado that are contaminated. I'm suspecting it might be the same in the state or wherever you live, that it's real common, especially in industrialized societies. So water supply is huge. This is why our reverse osmosis filters and our carbon filters are so key. I always say clean air, clean water, clean food. We kind of should not be doing anything without filtering our drinking water. That's so core nowadays. And then again, if you get takeout food, if you use canned foods or anything with the oil resistant coating, that's going to likely contain these chemicals. They can also occur just like mold, which is my other expertise. This chemical can get in the dust in our house, and dust is like a carrier of lots of toxic chemicals. So keeping your house clean and free of dust is also one way to reduce exposure, because those small particulate, like 2.5 microns and below, they can go right into our lungs and into our airways, and they don't even need any transport from the alveoli into the blood. So literally, I suspect if we started testing these urine or blood, we are going to find a lot of people have exposure. So how can they affect human health? Well, as all toxicologists will say, there's often, this toxic level, and I'll show you a little bit about that spectrum in a couple slides. But what the deal is that often these chemicals have synergistic effects. So when they combine with other chemicals, so we don't really know because we haven't studied them in all types of combinations with other chemicals. But what we do know is there's likely reproductive harm, there's likely metabolic, endocrine, immune effects, definitely effects on fertility and pregnancy, and increased risk of cancer. They are endocrine disruptors. So what that means is they act like hormones on the body and can cause endocrine disrupting effects. Very close to home, because my breast cancer at 25 was likely from exposure to endocrine disruptors, pesticides, chemicals on the farm. Who knows, maybe even some PFAS back in that day. Now, it is important to note there are some studies that show no human health effects, but I'm going to explain why that could be misleading, because a lot of times, like I said, in synergy or in hormetic levels, which means extremely low, below the typical toxicology levels, these things can cause hormetic-like effects, which means hormone-like effects, and actually cause just as much damage at the extremely low levels as the higher levels. This is the spectrum of vulnerability. I've shared this with many types of lectures that I've done, and I like this because a lot of toxicology is based on average threshold of harm. So where the 50% of the people start to have harm from a certain level of a toxicant. However, what we see, especially in our clinical practices, is those people in the more sensitive realm can be harmed by incredibly small levels. And this is why I'm really glad the EPA changed their levels, and that the article came out in July of this year for Colorado's levels all being toxic, because as the EPA says, hey, these levels at a much lower threshold are toxic, then we're going to start seeing, oh, our water supply is toxic, and then doing something about it instead of ignoring the problem and assuming that that higher level is safe. So let's just step back for just a moment and think about the whole toxic load, because I literally, since I've done these articles and talked to Vibrant, I've given this lecture on toxic load with this particular slide for probably 8 years. And I just recently, this last year, added that PFAS to the top of exotoxins, because number one, it's incredibly common and it's a forever chemical. And number two, that article with my state and the toxic load in my water supply. So you can just read these, but you can see there's lots of different toxins. I really think that part of the pandemic we just got through, and that part of our immune system dysfunction, our massive increase in autoimmunity, in cancers, and in neurodegenerative diseases are all related to the elephant in the room, which is our environmental toxic load. And this is why I'm so passionate about teaching on these topics, because once we understand toxic load, we understand why things are going haywire in our immune system, in our neurological system, and with cancer. And this is just a reminder that it's toxic load in our bucket. This is why testing is key, because when that bucket starts to fill up with different toxins, we want to identify what those are and help that patient to decrease their toxic load. What happens is if our bucket becomes full and starts to spill over the top with parabens and phthalates and glyphosate and heavy metals and PFAS and all of these different chemicals, when that margin hits the top and starts to spill over, we present with cancer, we present with autoimmunity, neurodegenerative disease, and also immune deficiencies and increased risk of viruses, and it's RSV and all these other things that are happening. And that's partially because the toxic load has overwhelmed our system. So one of the keys as a functional and integrative practitioner is to identify whatever you can in your patient's bucket and try to decrease that load so you regain margin. And when you regain margin, all of a sudden you can start to function as we were made to do, which is to detoxify. We're detox machines, so we all have it in us. It's just a matter of, as this environmental toxic load overwhelms our system, then we start to get sick. So that's just a reminder, how full is your bucket? And the last little slide from, again, some of my past lectures is just symptoms, because these are super common, this list: concentration, food cravings, trouble losing weight, rashes, skin issues, brain dysfunction, brain fog, which is just a term for subjective cognitive decline, fatigue, muscle aches. All of these things can be related to this toxic load. Okay, so why do we test? I feel like this is so exciting because Vibrant has been a leader in giving me a panel that I can do all in one, the tox bundle, and now it's expanded to include PFAs, because if I want a reasonably affordable test that really gives me a handle on what's in that patient's toxic bucket, this is a great way to do it. And now, starting today, Vibrant has the PFAs available as an add-on, and I'll tell you about that in a few minutes. So this is a urine test that will detect PFAs in the urine and the chemical metabolites. And I'll show you the list in a few minutes. It's very extensive. I think this is, again, one of those ways that we can look at the toxic load, how full is that patient's bucket, and identify what's in there so we know what to do about it. And again, the more we know, the better. And what's happened with toxicity profiles is we don't have great, completely comprehensive, like when I showed you that list of endotoxins and possibilities, up until now, there hasn't been testing for PFAs, and there hasn't been testing for certain things. So it's hard. You can identify some things, but not everything. So the more data we get, I think the better. So this is an analyte list, and this is very chemical, maybe confusing. I just want to highlight, and I'll talk about these in a minute as I talk about long and short chains. The most common in that map of Colorado that I showed you included this PFOA and the PFOS, which is down here in the middle, and then this is called Gen X, and those are the top three that they're actually testing for, at least in the state of Colorado. But as you can see, this list is incredibly long, and there's lots of other sources of PFAs as well. And Vibrant does 21 markers. You can see on the left side, there's the shorter chain PFAs, and then you can see on the right side, the longer chain. Now, the longer chain, as you can imagine, these are very incredibly tough bonds as well. And the longer chain are even more difficult to break down. And you can see the two most common that I just mentioned, the PFOA and the PFOS are both a long chain carbon. So the more difficult ones to break down. So the bad and the ugly, there is no good. I love this slide because these are difficult to break. And this is why they're called forever chemicals. Scientists, I said it before, I'll say it again, they don't even know how to calculate half-life. It's that crazy. Like, that's bizarre to me. So the longer chains are more toxic potentially because they have a longer half-life, even though we can't even calculate it, and likely more bioaccumulation in our tissues. They're less likely to dissolve in water, and they could be transported by particulate, which means like on dust. So a lot of these chemicals, just like mold and mycotoxins, they ride on dust. So they're more dust and debris and dirt that we have in our environment, that we breathe in our air. This is another reason why, like I said before, clean air, clean water, clean food. You want to have an air filter. This is part of this as well, because when you filter the large particulate with your HEPA filter, the particulate matter 10 and 5, and then that particulate matter 2.5 and below, which is like VOC level, that's the kind of thing that you will decrease the load in your environment. And this is more likely to be found in soil, groundwater, and plants. That's a whole nother thing. I don't know that we have the data or that I could explain if it's imported into plants through the soils. It's possible. I don't know the answer, but it's certainly possible. Shorter chains may pose more treatment challenges because they're more potentially volatile. They could react to other chemicals, so that synergistic effect with other toxins could be greater. They might be more mobile in the environment, so they might disperse farther or go in the air farther because they're lighter. They are more likely to dissolve in water, and they're more likely to be found on surface water or plant shoots. So there's problems with those as well. This is some of the short chain ones. I will not read all this, but you can just glance through that and see, PFBAs are adhesive cosmetics, cleaning products. You can see some of these PFPEAs are resistant to oil stains, and all of these are typically contaminated drinking water. But as you can see, the fourth one down there, PFHPAs, inhalation and dermal contact. So as say you got a new rug and it was resistant to stains and it had the PFAS in it, say you're laying down playing with your dog or your child on the rug, you could technically get some absorption or some contact with the skin, as well as inhalation and through drinking water. So there's multiple ways, even though the most common sources are food and drinking water. And again, this is just the list continuing of the long ones. That PFOAs is one of the popular ones. And you can see firefighting foams, which is why, again, Colorado, California, where there's been wildfires, this is a big deal in our environment just from that perspective, because it's so massive. As I take this, if you've never seen a wildfire and those planes spraying that red stuff in the air, it's kind of scary. Obviously, the fires are maybe even more scary, but this stuff is like chemicals being just sprayed in our environment. And part of that is PFOAs, and the other part is flame retardants, and there's other chemicals as well. And you can see on this list, there's more of these long chains, and again, whether agriculture, stain stick resistance, all kinds of things. And the exposure, once again, is mostly contaminated food and drinking water. And you can see on the right, the potential risk. I mean, there's a lot. I'm going to show you system-based risk in just a moment. So multi-systemic harms. This is just like we talk about chronic illness, multi-symptom, multi-system. This is no different. These chemicals have systemic effects. This was a provider resource for the PFAS tox database. And you can see here, if you look at the top, the different chemicals are listed on your left, and across the top, you can see, metabolic toxicity, body weight, endocrine. Now, we know endocrine disruptors. I don't know if you're a practitioner or patient or client listening, but you all know that obesity is increasing dramatically. Metabolic disease and diabetes is increasing dramatically. And if you're a practitioner like me, what you've seen is more and more normal weight, healthy exercising individuals that are developing either diabetes, or for no reason they start to gain weight. I see that with mold all the time, and I realize the connection to toxicity, metabolic disease, and weight gain. And this is no different. This could also be another source of the increasing obesity and metabolic epidemic that we're seeing. Love this slide. And what I really like here is you can see all the different endocrine, respiratory, digestive, reproductive, skin, muscular, nervous system, cardiovascular, lymphatic. And you can actually read in the studies some of the potential harms. And this literally covers all systems. So I think it's a really big deal. And I think, again, it's even more important to do in conjunction, because just knowing PFAS isn't enough. Just knowing other chemicals, phthalates, parabens, volatile organic compounds isn't enough. Organophosphates, just knowing mold isn't enough. What I love about the availability here with Vibrant is we can check all of these and do it fairly easily with urine, and do it fairly affordably. So who might benefit? I already gave you a list of kind of the symptoms you might see, but this is kind of some of the systems or the diseases. And I could have listed 20 more things or more. Think about autoimmunity in particular, but here, thyroid disease. Our thyroid's like our canary gland. It's that thing that's most susceptible to environmental toxins. So it's definitely common. As if you're a practitioner like me, you're seeing, I don't know the last patient who doesn't have some thyroid dysfunction. I would say maybe 80% of my patients have some sort of thyroid disorder. Interesting, I'll just say from my personal experience, I grew up on a farm in Illinois. Lots of atrazine, lots of chemicals, I think, contributed to my toxic load and my breast cancer diagnosis at a very young age. But interestingly, I was 25, diagnosed with aggressive breast cancer. My sister, I don't know, maybe 8 years later, when she was 28, she was diagnosed with thyroid cancer. Now, isn't that interesting? Two sisters growing up, same environment, same well water, same farm, both get endocrine-related cancers in their 20s. So we obviously have similar genetics, but think about that. I think the environment is very clearly was part of the toxic issue in my case. And again, that's why I'm so passionate about this topic. Lipid, high cholesterol. Again, that's often when your liver gets stimulated, or you're hypothyroid. There's other reasons for that, but that whole metabolic disease issue often starts in the gut with endotoxemia, and this endotoxemia, leaky gut, dumping of toxins from the gut, from the bacteria into the bloodstream, is all part of this toxic load as well. Kidney disease, those are one of our filter organs, right? So liver and kidney are definitely affected. And then ulcerative colitis, inflammatory bowel disease, and cancer, as I mentioned earlier. So what do we do? This is kind of depressing, right? Can we do something about it? The answer is yes. Drinking water is huge. So once again, I always say clean air, clean water, clean food. It sounds simple. It's not always simple, but you want to make sure you're breathing clean air. And even though we say the majority of our exposures of this are drinking water and foods, it's still really critical that you have air filtration, including HEPA filtration and VOC in your home, your office, almost anywhere. Even in my car, I have a little filter that I stick into the cigarette lighter and use in my car. And so clean air, clean water, reverse osmosis is under sink. So you can either do like under the sink reverse osmosis systems, which does your whole house. And that way, when you're showering or bathing, you're all getting clean water and you're cooking. You can do a fridge pitcher. In the Q&A, if you want to ask me like what I use, I can tell you, but I don't want to be promotional here at any certain brand. You just want to get a good filter that I have one in my fridge. I have one on my countertop. I have multiple sources of clean water. I do not recommend doing bottled water. You can get, if you have spring water locally, you can get them in glass jugs or bottles, but I do not recommend the BPA exposure with plastic. Reverse osmosis is the best, but any carbon filter will also remove to a certain extent and probably is just as good. Dual stage under the sink, and then the carbon activation. And you really want to look into this and get a good carbon filter or a good whole house filter, because it's a big deal for your whole family. This is that map that you can look all over the US. It's called PFA Exchange. So you can actually check your area and where it's been found. The one I showed you earlier was from my state of Colorado, because as I saw that article, I've been researching it, but you can look in your part of the country as well. What else? So watch the foods, watch the fast foods, watch the takeout. Whenever you have a chance to use something that's non-stick coating, that's the best. Check your product labels for things that say fluoro or perfluoro. Those are fluorinated compounds that are these sticky chemicals that are hard to break down and going to be problematic for our body. Now, this makes sense hormonally, because if you remember the periodic chart, we have chlorine, fluorine, bromine, all these, right? So the same as if you were to swim in brominated water, you drink, so all these fluorinated compounds affect our hormones because they replace iodine in our body, and especially that affects breast and thyroid and some of those. Getting rid of any nonstick pans. I, for decades, have not had any nonstick pans. Now I think ceramic is safe, but cast iron and stainless steel are probably the best. Be aware of the packaged foods, no microwave popcorn, cut back on fast food, and then watch the stain resistance carpets and upholstery. Again, sometimes you can't avoid this, but at least you can minimize your exposure. Clothing, luggage, camping, sporting goods. Again, this is big in Colorado. We all love our recreation outdoors. And so a lot of our equipment is coated. I'm a skier, I'm a rock climber. I love to be outside. I love to hike. And a lot of the things that we use on a regular basis to resist the water, the rain, the snow contain these chemicals. And I don't know the data on skin dermal absorption, but I'm assuming there is some absorption or at least exposure that way as well. And again, there's no current recommendation for treatment to remove PFAs, but I have some ideas because detox is where it's at, and I'll go through those as well. So supplements studied in PFA exposure, and a lot of these make sense because I use most of these with any other toxic exposure. And I think if you're a practitioner, sometimes it can be overwhelming because you're like, okay, which thing, what do I do? The big important thing is you want to make sure bowels are moving. You want to make sure biotransformation, liver phase 1, phase 2, gallbladder is working. You want to make sure your lungs are working and you're breathing clean air. You want to make sure you're hydrated. You want to make sure you're sweating adequately. So maybe adding sauna. And those kind of basics are core for almost any toxic load. So even though it's helpful to know exactly the profile of the toxins your patient is exposed to, you can still think about detox in general and get a good result regardless of the composition of exact toxic load. So fibers like citrus pectin have been shown to be binders for toxins forever. They're very powerful for organophosphates and some of the things that we see in like farmed fish. And that vitamin C, of course, enhances detox. Resveratrol, another favorite of mine. Also, some of the studies on Lyme disease, Japanese knotweed, and cryptolepis were top performers. So we're top performers, so I'm a huge fan. Choline, this is my new favorite ingredient, favorite thing that I take, PC. It's so powerful. If you think about those lipid bilayers in all of our cells, those phospholipids, those are the cell signaling parts of the molecule. And when they get sticky with trans fats and poor dietary choices, this choline is like an oil change for our brain and nervous system. So I'm a huge fan of using more PC. You can see down there curcumin, which is a hot item for anti-cancer, anti-inflammatory, so many different things. General antioxidants, so brightly colored fruits and vegetables and berries and vitamin C, vitamin E, selenium, all of those things. Anthocyanins, again, in brightly colored fruits and vegetables, purples especially, green tea, and then bile acid sequestrants. I am a huge fan, and of course with mold we use binders, which are also bile acid sequestrants, but I am a huge fan. I feel like lifelong in a toxic environment, clay, charcoal, glycomannans, Welcol, cholestyramine are all probably going to be a part of just daily decreasing our toxic load. So super important. And those are just a few. Other things you might consider would be sulforaphanes. You might consider alpha lipoic acid. You might consider N-acetylcysteine, and you might consider ways to increase glutathione. Some people do great on glutathione, but I'm not a huge fan of giving huge doses of IV or oral glutathione. I actually like giving precursors just as well. So let's talk a little bit about Vibrant's test, the new test. I am not a technical lab person, so slide is probably over my head, but I can explain the basics. They use liquid chromatography to separate the different chemicals because they're different sizes, and then they measure using mass spectroscopy. And before the webinar, I literally talked to the company and asked lots of questions, and their equipment is the state of the art, some of the best that money can buy. So, and what I've seen in my clinical practice, because I've been doing the tox profiles for several years, I've had many patients where I go through those and then I ask questions about source. I had a young man the other day that was doing some photography printing, and the chemical he was using in the development was actually shown on the urine. So I often do see a very clear correlation as I ask the questions of where the source is of their exposure. So at least from my experience, I'm getting excellent results. Specimen collection, again, very simple, urine specimen. The great thing about this is if you've ever been doing any of Vibrant's tox bundles, which I do all the time, that already have mycotoxins, heavy metals, glyphosate, and other chemicals in the environment, the environmental tox bundle, I love that because it does all these and it's one urine sample. So if you want to add this PFAS on to that tox bundle, it's simple. It's the same specimen. You don't have to get any more urine, and it's just really easy for your patients. So it's the last slide here, and it is a really good deal. If you just order the PFAS urine test from Vibrant, it's $240, which again is a great deal. In my practice, I'm going to be doing the tox bundle. It's called Total Tox, PFAS, environmental toxins, mycotoxins, heavy metals. And again, now it normally would be $600, which is still a really good deal for all those tests. Today, and I believe we'll clarify after the webinar, for 2 weeks, if you order, it's only $400. I'm doing it for myself, and I've already this week, because I knew about this, I have ordered 2 for my patients just this week alone. So it's a really good deal. So this 2 weeks while you're, wanting to get to know the test, and if you have patients that want to order that, you can do today. Up until, looks like 11. So today is the 18th. Yes. So up until 11/27, you can do for $400 for all of those, 1 urine sample. And then the other thing they're going to be doing soon, I don't have all the details on this, but Vibrant will soon, the detox genetics. They're going to add that on as a $199 add-on. So the total tox and detox genetics in the future after the special will be $799. And let me show you the reports. This is what the PFAS are going to look like. On the left, you're going to see the actual levels that come up high, suboptimal. And then on the right, you can see basically percentile, kind of like you see with environmental toxins or any of the other ones. Those who are in the 75th percentile and above will go into the yellow range. And if they're above the 95th percentile, they'll go into the red range. And this is based on healthy controls. That was my question is, how do you base this on? I'm assuming as we get more and more data, this will just continue to be refined. But at this point, healthy controls is our control group. And then, as I mentioned, detox genetics are coming soon from Vibrant. They'll be checking some of the top xenobiotic metabolizing SNPs, mold sensitization SNPs, mycotoxin elimination SNPs, NAC, cadmium detox SNPs, and others. So stay tuned because that will be coming. Awesome. So thank you all for joining me. I'm happy to stick around for a few minutes of Q&A. Otherwise, I'm whatever you need, I'm here. I see some questions, so I could jump into that too, if it's helpful.
Yes, that would be great, Dr. Jill. Thank you so much. Do you need me to read those off to you, or are you able to access those?
I can see them. So Sarah says, what's the most effective binder for PFAS other than cholestyramine? So that's the interesting thing, Sarah, is we don't really know. Or if maybe we know and I just don't know. I think we're going to learn, but clearly the bile acid sequestrant. So anything that's a bile acid sequestrant, I'll just say honestly, in clinical practice, I don't use a lot of cholestyramine. I find it more harsh, harder to take. If I'm going to use a prescription binder, I'm using Well more often, but I love charcoal and clay, and charcoal is literally my favorite. It's cheap, it's easy, it works for some of the worst molds. Patients usually tolerate it. I'm guessing charcoal and like a combination of charcoal and cholestyramine, or charcoal and the Well would be great. You could also use things like bile acid cholagogues, so things that are like the bitters, anything to secrete that. And then, as I mentioned, citric, some of the citric acids and things are incredible binders, citrus pectin, because those have been studied in some of the chemical compounds and things in the past, and they're very good organophosphate and toxin binders. So you could add some fibers and things too. And the great thing is, I think just even dietary fiber would be helpful if you didn't want to use a prescription. Sarah, duration of time needed. Again, I don't know the answer to that. I don't know. I think some of this data is so new and as far as how we detox and stuff that I don't know for sure that we have the answer. But my assumption is I don't ever think about detox as a 21-day thing or a 4-month thing. I think of this as a lifelong thing for all of us because our world is so toxic. We need to teach our patients and incorporate our own ways to daily detox. For example, I take an Epsom salt bath almost every night. I use dry brushing almost every day. I do infrared sauna once or twice a week. Those are just part of my daily routines because of our toxic world. So I've incorporated things like that. I take glutathione, I take NAC, I take arlypoic acid, I take all of these things, sulforaphanes and resveratrol. That list that you saw, most of those things I'm on every single day. And I think as we go in our toxic world, we're going to need to find a way to incorporate these kind of as a daily thing. And if we can't go that with supplements, go back to clean air, clean water, clean food, because the inputs matter too. Varsha, thank you. She did a great job. Great to see you here, Varsha. Ira, what about glyphosate? So this I'm going to ask Viper because yes, glyphosate is on my tox bundle test. Is that included in this new bundle or that's a separate? I didn't know for sure. Do you guys have the answer to that?
I don't have the answer to that, Dr. Joe, but we can certainly make note of that and get back to people if they have questions regarding it.
Okay, I'm guessing I could be wrong, so I will let Vibrant correct me. But right now, when I do the tox bundle, it's the chemicals in the environment. The PFAS will be new, the heavy metals, the mycotoxins, and the glyphosate, and that's my tox bundle. So I'm assuming you could do similar, but I'll let them clarify if that glyphosate's an add-on or not.
Oh, we actually just had someone from Vibran chime in. I know a lot of our employees are also watching. They did say glyphosate is in the environmental toxins. So
thank you for clarifying, because that's what I thought. And
Patrick.
Yeah, because that's another big one we want to know about. And then Katie, top recommendation for air filters and car air filter. Air filters, I like the Austin Air. I have 5 in my office and 3 in my house, but IQ Air is excellent. And I really like the new Air Doctors, kind of newer kid on the block. All 3 of those are excellent. I'm not a big fan of the ones that create ozone when they react with, so there's a molecule and a few of these others. Doesn't mean they're bad air filters, but my patients with lung sensitivity like myself, I don't do well with those kinds of air filters. So I use the ones that don't have any reaction, no ionic thing in the environment, because the people with real sensitivity don't always do as well. It's not that they create ozone. They'll be very clear to tell you that. But when that ionization reacts with dust and molecules in the environment, it can kind of create an ozonated or a reactive oxygen product. And that can be irritating. So I like IQ Air. I like Austin Air. I like Air Doctor. They're all excellent. And I'll mention water filtration too. So I am a huge fan of clearly filtered. I have water bottles and I have one in my fridge. Berkey is a countertop system. I have that too. I have both. Reverse osmosis, I have looked into those and I have some names, but they're not on the tip of my tongue. So I don't have an answer for the best system there.
Fantastic. Any other questions while we have Dr. Jill with us? And just
okay, I was just going to say, and I'm going to let you go, but I want to mention one thing because I asked Susie and she said, no problem. Just in case you want to read about my story, I do have a book coming out and I promise I'll keep this quick and then I'll get off the screen. Readunexpected.com coming out in March. So if you want to really read my whole story, check that out, readunexpected.com.
Awesome. That I promise will be a good read because I've heard the short version. I'm sure it's terrific. There is a couple other questions. I don't know if you still see those in there, Dr. Jill, but I do want to remind people before you wrap up those last couple questions that this test can be ordered right now through the Vibrant portal under seasonal panel. And if you're utilizing our Well ProZ e-commerce platform, you can also add that to your shop as well.
So replenish RO water. I'm not sure what you're asking as far as replenish system that's hooked up usually under your sink to your main water supply, and it filters the water as it comes into your house. So I'm not sure about the replenish, what that means. I suppose maybe there's like a certain amount filtered, and then if you use it all up in your bath or whatever, it might take some more time, but I am not the expert on that, so I don't know that I have the answer. The other thing on that, you asked about car air filter. This is funny, I don't know the name, but if you go to Amazon and look for car air filter cigarette lighter, it's 20, maybe less than $20, it might be $16, and it's a little blue light that clears the air, and I just literally stick it in my cigarette lighter. They're very easy to find. There's probably, if you search there, you'll find about 20 of them. They're all about the same. And I think that's all the questions. Was there one more?
I see one more
Oh,
in
yeah.
here, if you have
Cool.
a second.
Oh, great question, Sarah. You're full of good questions. So reverse osmosis, yes, it does deplete the minerals. And this is why I use the fridge and the countertop a lot more. So reverse osmosis pulls everything out, including minerals, and you have an acidic product. So this is a little bit of a problem because once you have acidic water coming in, your body needs to buffer to maintain pH, and you can literally pull your own minerals from your bones and things. So if all you're doing is drinking RO water and you're not replenishing minerals, or doing something to alkalinize your body, you will likely deplete minerals. So it is important if you use an RO filter and that's the only water you drink, it's going to be clean, but you are going to be depleted. You need to add a mineral supplement in. And I'm a big fan of spring water or sparkling water like San Pellegrino or Gerald Steiner or some of those, because those are full of minerals and they're clean. They're from, deep mountain sources.
Amazing. Well, I, as always, have learned so much from you, Dr. Jill. Thank you so much for being here. And we just hope everyone has a wonderful weekend. And thank you again for your time.
Thank you, everybody.
Bye-bye.